반갑습니다.
Nice to meet you all.
포럼을 시청하고 계신
Those of you who are watching this forum, I would like to welcome you to Seoul Big Data Forum. I would like to also thank the speakers and discussants for joining us today. Session 5 is going to deal with the theme of inequality and gaps in COVID-19 affected cities in the eyes of big data. The Seoul Institute is hosting this session. In this untapped world, many citizens are feeling high level of anxiety. During this period, some people are looking for new opportunities, some people are in great suffering. This pandemic universally affects citizens, but the impact is highly unequal and it widens the gaps. The Seoul Institute is dealing with this new type of disaster pandemic and ensuring urban problems, inequality, and gaps. Through today's session, I hope we can have new understanding of inequality and gaps and pave the way for finding the solution and utilizing big data in resolving this issue. So let us move on to the presentation. The first presenter is Officer Bruno Dercon. He's from UN Habitat Asia in Japan, Fukuoka. He's a senior human settlements officer. He's an expert in urban development and urban planning. He has worked in China, Myanmar, Nepal, China, Pakistan, and East Timor as a part of UN Habitat program. And when it comes to complex and large-scale disasters, designing the recovery and resilience of cities, he is also an expert in the field. UN Habitat recently, it has published the future report for AP, Asia Pacific cities, and future epidemics report. He was one of the authors for these important reports. So please start your presentation.
Good afternoon. Very much thank you for having UN Habitat, the regional office for Asia Pacific from Fukuoka, Japan, to have us in this event. Thank you to the Seoul Institute. Thank you to Professor Seungyun Kim and the Department of Urban Data and Information. Thank you also for raising an important issue, which is fundamental to the work of the United Nations and UN Habitat. Increasing inequality accelerated by COVID-19. I'm glad that you flag the issue of inequalities within cities and countries and in between cities, countries and regions. Yes, indeed, on so many issues, the pandemic has been an eye-opener, the moment of truth in relation to urban resilience and the capacity of cities to deliver services on the urban economy and its dependence on these modern services. As the American urban economist Ed Glazer recently said in a UN Habitat conference, who would have thought that the smile that comes along great service, for instance, a barista when brewing you a fresh cup of coffee in the morning on your way to the office, who would have thought that that smile of great service would become a smile of peril, a smile of death? The great divide of social distancing and contact-free work and life is also a source of great destruction of jobs, services, hospitality, tourism. The future of work serviced by Zoom is a middle-class luxury. The future of work for millions of service workers is joblessness, COVID, long COVID, losses, debt and foreclosure. But that Glazer underscores the undeniable strength of cities as the source of innovation and prosperity and the ticket out of poverty for millions more in developing countries. Probably the only ticket out of poverty for hundreds of millions. The world today is an urban world. The world of tomorrow will even be more urban. The pandemic destroys, but so does innovation. It is up to policymakers and agents of change to invent the solutions that bring sustainability, inclusive prosperity, and resilience. And I'm glad to be in this forum on big data. Big data, big expectations is not a statement of irony. I'm not forecasting failure. I'm stating here the obvious fact that we are in the same boat. Data specialists, big data innovators, and those like me working for sustainable urban development across countries and regions, leaving no one behind and no place behind. We are in the same boat as urbanization thrives on the same density and agglomeration benefits as big data thrives on. Big data are digital ecosystems needing the real-time ecosystems of big cities, but we require governance, social innovation, resilience thinking and inclusion to deliver real benefits for people. That's true for me and that's true for you. So let me here then introduce the headings of my intervention. First, I will talk about people-centered smart cities. That's really the key message from UN Habitat in our strategic plan, and it's the title of our flagship program on smart technology. Next, on data and urban sustainability, a quick survey, no more, of what we and development colleagues currently do in relation to big data. And finally, my takeaways and an invitation and appeal for more collaboration with you. Global flagship publication delving into the messages of the new urban agenda. And in the new urban agenda, all member states agree that urbanization is a crucial driver to achieve national prosperity. Urbanization brings value, sustainability, if well planned and managed, socially, environmentally, economically, spatially, through collaboration, and well planned and managed through genuine innovation. Now, the chapter on innovation and technology makes a good case on the key issues. It starts by stating that city governments can be platforms of innovation, creativity, and knowledge generation. The agglomeration principles are at work. The density of actors and agents of change, creative and clever minds, the scale of issues delivering economies of scale to good solutions. City governments can be, should be innovators by developing or adopting legal and institutional innovations aimed to improve and transform government processes and service delivery. So the chapter that I was discussing makes a case for civic technology. Beyond the gig economy, it's appealing for people-centered technologies, supporting stronger participatory and democratic processes, more 311, more fixing waste problems and potholes through digital procedures, and keeping a tap on community safety issues through them. Less Uber, less Grab. Obviously, you will agree that big data and artificial intelligence is increasingly delivering more benefits in automation and optimization. I will come back then on the issues of trust, reliability, and rights. But in complex and fairly poor government settings, for instance in developing countries, we see a host of applications emerging by national governments, cities and private companies, and in the most of diverse of combinations. Take, for instance, China. In 2020, UN Habitat published its first Future Cities Advisory Outlook report on the state of smart technologies promoted by competitive private companies and in collaboration with them, and about the scaling up of these technologies, but also of monopolies, into city brains. Now, the report here on the screen on the value of sustainable urbanization, shares the overall sentiment, also in UN Habitat, that technology firms have not scored well on promoting smart cities. I'm sure that you actually know much more about the failures and the false starts. So, as this report is focused on sustainability drivers through well-planned and managed urbanizations, it puts the focus on bottom-up smart city approaches, open data, which are the cornerstone for that. And so is the open source movement and the hackathons and urban labs. The chapter then continues on the challenges, the uneven geography of innovation in the world, but also in regions and in the urban-rural divide. That is a political and economical reality of unsustainability enhanced by the forces of urbanization, which concentrates wealth in cities. The report also digs into the issues of digital inclusion and literacy, so much exposed to us during COVID-19, and of data privacy and other perils. And so it concludes on the vast expanse of digital governments that we need and digital rights. So let me continue here by quoting observations during a launch of an initiative sponsored by UN Habitat and others on people-centered smart technologies, So this is here an area where we try to promote solutions for a better urban future. For sure, the world of cities and local governments is one with many pitfalls. And I'm quoting here, these are not my words. It was the observation about elite capture, of limited public infrastructure, of divided and unequal cities, of fragmented civil societies, of low levels of state capability, the lack of capability to engage in multi-level governments. And I add to that the deeper problems of a stalled democratic decentralization, and on top of that, we come close to our subject, outdated regulatory frameworks, especially regarding digital human rights and digital governance. Now, these comments were made at the launch earlier this year of UNITAC, the UN Innovation Accelerator for Cities. It's an initiative that brings together UN Habitat, OICT, the UN Office of Information and Communication Technology, and the University of Hamburg. Germany is funding the collaboration. The focus of UNITAC is pretty interesting and reflecting the observations just made about devising approaches that deliver value in developing countries with capacity and in conditions of informality. Informality, by the way, which is the increasing social and economic inclusion of citizens and workers through e-applications and systems. That is moreover an issue that has moved to the top of the agenda of the United Nations because of COVID-19. So UNITAC will focus on delivering value for developing countries with UN Habitat and OICT in 3 areas. First, the thematic area on digital governance. The key issues are interoperability, procurement, public-private partnerships, digital inclusion, and digital rights and ethics, including on privacy and security. Thematic Area 2 digs into digital innovations in urban and mobility planning, exploring new software and hardware tools for urban managers and urban planners. And Thematic Area 3 seeks to expand the understanding and good practices on people-centered smart cities. The UNITAC initiative acknowledges that too much piloting and not enough scaling up has been going on in the field of smart cities, and have too much focused on low-hanging fruit of small upper-middle income communities. So it will seek fresh thinking, proof of concepts focused on real needs of cities and citizens, contributing to inclusive and sustainable development. In short, expect UN Habitat to further promote the theme of people-centered smart cities, and we are for sure looking forward to new Korean collaborations. Let me now move forward to the second part of my intervention, on data and urban sustainability. My next slides and messages are really not about cutting-edge innovations. I wish simply through a few examples sort of the few areas of work with regard to innovation and big data which are already coming up in our work. Let me start with a brief scan of the innovation programs or UN Habitat programs where digital innovation has come into play. Some of them are global, some only are taking place in one or a few countries. Innovation application range from using tables and simple tablets, and simple open source software in our country programs, for instance on land management and land tenure rights, to exploring the use of blockchain for land registration in countries where cadastres do not exist. Then there is the block by block program, which is long-standing and global. It collaborates with the Minecraft Foundation using Minecraft software, allowing communities in developing countries to co-design public spaces, new ones or for regeneration. Mapping tools are also increasingly used in participatory slum mapping. We have a few programs that focus on basic air pollution monitoring and others that engage in local area predictive modeling, for instance, for climate adaptation planning. The area of climate change is, of course, very data hungry. I show here the data-focused sessions of a global 5-day, 24-hour non-stop conference marathon organized in October by UN Habitat and the Global Covenant of Mayors on Climate and Energy. The Innovate for Cities conference had not really a focus on big data. You see, left up there was a discussion linking big data issues with bottom-up innovations like hackathons. Our partner ICLE and Google had a session on a fund that they have established to promote data solutions, but not necessarily on big data. Meanwhile, most sessions were on data and predictive modeling, with a key focus on downscaling, decentralizing, localizing, and for all within the context of predictive modeling, bringing together remote sensing, big data, and artificial intelligence, possibly augmented with local centers. This is the key area of innovation that I see in relation to big data. For instance, UN Habitat's Myanmar team explained the predictive modeling methodology they developed for rural townships in Myanmar, combining climate and agricultural data to come to forecasts on weather conditions by 2050, on agricultural land coverage changes by that time, and migration as a result. Just allow me to go back to basics. This session queried about how big data can contribute to reduced inequality. The real question is, of course, about big data as a tool to reduce inequity. In 2020, in the flagship publication, this simple picture was included, borrowed from UN Women. People are not equal. Long-term interventions like nutrition may reduce stunting, but not all people will be the same. In the same way, the drivers of urban agglomeration and innovation foster inequality. Inequity is when some amongst us cannot enjoy opportunities in the same way as others can enjoy them, like watching this game. We can offer fixes to undo particular challenges, like adding boxes in the picture in the center, or building a ramp for disabled people, or providing aid and grants. But what we really need are solutions that are inclusive out of themselves, like on the right, the screen. I therefore highlight this example again from the innovation chapter of the 2020 World Cities Report. It is about the collaboration of Google, MIT, and others that created a transport chart out of mobile data from the thousands of informal taxi vans in Nairobi, the Matatu. It was a great success, as people now had a Google Map application showing Matatu vans on the move, near to them, going where. They could set out predicted travel times. And that was before the case with e-money on phones. With M-Pesa, East Africa had shown the benefits of leaping forward in terms of innovation applications. At that time, foregoing banking access in lieu of SMS-based money transfers. With this application on mobility, Nairobi had in a quasi-instant a public transport map and tool, which we take for granted in developed countries. Now, additional data mining showed, however, that the Matatu transport system was not necessarily serving long-term sustainable mobility. Middle income and middle up income groups actually enjoyed more access. This is about Nairobi. People with small service jobs, they are middle income and they can pay a little for the dense transport network in the city in order to get by in an income segregated city. The Matatu pick up workers in middle income neighborhoods and drop them off in high-end neighborhoods where they work in shops or do gardens or work as security guards or in offices or as cooks. Meanwhile, the poorest, without jobs and money, of course, live in de facto ghettos, those in the red and orange areas. So the Nairobi Matatu mobility platform, the tool, the application, is a really nice and instructive example, showing first how data and big data can fairly swiftly bring change in the lives of ordinary people, make lives easier, make them gain in developing countries. But secondly, it's also a good tool to seek change to bring more equity for groups that are excluded from transport systems, but also more equality, because the spatial inequality of Nairobi is significant and the current system of mobility reinforces it and will prolong it. And there we need together seek new solutions. So let me very briefly land my contribution with a few takeaways and appeals. First, I show you the front page of UN Habitat's 2021 publication on cities and pandemics, where we reviewed the major issues globally with regard to density and urban form, poverty and inequality, the urban economy and urban governance at the onset of the pandemic. The title speaks for itself and is a message in itself. The urban future can simply not be otherwise than more green, more healthy, and it also needs to be more just. So going forward, allow me to invite you to explore big picture questions, to imagine where big data can contribute in development. For instance, here a screenshot from the Secretary General's data strategy, which has some pretty good questions on where sustainable development and the UN needs the power of data. A couple of them I have already mentioned: climate impact modeling, predictive modeling, open data, but also note the issues where big data come in, like hate speech monitoring, and in areas of conflict prevention, and of course SDG data tracking. Well, let me add to that in the field of urban data, we face genuine challenges. UN Habitat is currently compiling the second progress report on the implementation of the new urban agenda, and urban data remains the key challenge in global urban reporting. And then really finally, I call for your attention and advocacy in support of the Coalition of Cities for Digital Rights. Started in 2018 with the support of UN Habitat, the coalition of 45 global cities commits to 5 areas of the declaration. You see the 5 points, which includes the issues of open data and public algorithms. As said before, cities like Amsterdam, Barcelona, and Helsinki are rushing forward on these commitments, surpassing national governments in many places. And here is my call. To date, no city in Asia Pacific, including Korea, has joined the coalition. Allow me to conclude by saying I like to hear your feedback, whether this is because there are parallel initiatives that are holding up in this region, or more likely, there is a lot for us to do. I would really be pleased if a Korean city, with support of the Seoul Institute, would become a member of the City Coalition for Digital Rights, expanding in this like an UNITEC setup with North-South collaboration. Thank you.
발표 감사합니다.
Thank you very much. Well, this was like a keynote address of the second session, which is the inequality and gaps in COVID-19 affected cities in the eyes of big data. From the UN Habitat perspective, you have given us quite strong message. Lastly, post-pandemic cities should be just, eco-friendly, healthy city. Those keywords really touched my heart. And I believe that our discussion should be directed that way as well. Let me introduce the second speaker, but before that, let me briefly introduce you how we are going to proceed the session. We will hear the presentation by 4 speakers first of all. Sorry, 4 speakers, and we can briefly ask questions to the speakers so that we can stop any misunderstanding in advance, and then we will invite the discussant so that we can hear their discussion. So if you have any questions while you listen to the presentation, write them down. As soon as the presentation is over, you can pose a question to the speaker. And upon listening the presentation, a lot of people joining us virtually, please make sure to write down your question and post it so that I'll do my best to address those questions as much as possible.
Dr. Kim Seungyun is the next speaker. He is the Director of Department of Urban Society Research of the Seoul Institute. He is active in researching the welfare and healthcare related data. Especially, he has access to income and property related data that's very rarely available in Korea. Nice to meet you. I'm Kim Seungyun from the Seoul Institute. I study social policies, so Big Data Forum sounds kind of stressful for me, but I would like to share some of the research projects that I have done recently. Last year, the Seoul Institute and Gachon University Inequality Research Institute jointly used NHIS administrative data to study inequality. First, we used the National Health Insurance Company's data to look at individual level income inequality and poverty. And then we also did some social mobility analysis based on that. The reason why we decided to use NHIC data was that in early 2010, the level of inequality in Korea was lower than OECD average. Because of that, we began to question, is our inequality level lower than OECD average? Is it true? OECD data for Korea, most of the data has been based on survey data, but survey data have fundamental flaws. Mainly, there is a lot of less representation of high-income people, and people tend to underreport their assets. So we thought that inequality might have been reduced greatly. And Professor Kim Na-kyun in 2019 looked at national income tax data, and he estimated that Korea's inequality was actually higher than OECD average. And the Korea statistics looked at household data, and now they're looking at household health and welfare data. And this is different because for national income, they look at national tax data. So a lot of income data have been made more realistic and accurate. And as of 2017, Korea's inequality level was turned out to be higher than OECD average. So the survey data has another flaw, and we are a Seoul government, local government. And for local government, when we get national level data and sampling is done at the national level, then when a local area wants to use the data, there is terrible shortage of local sample. And if there is a lack of local sample, the reliability of the data could be made lower. So it's difficult for local governments to use national level data. Of course, we do some research survey data ourselves, but as a it's a local government, there is a limit to having accurate information for welfare. So whenever we decide welfare policies, we have a hard time deciding how to determine and assess the income data. Income data is critical, but local governments often do not have accurate income data. Last year, the Seoul metropolitan area has decided to provide welfare subsidy under a certain income level, but we did not have the data to calculate that. It was difficult to have an accurate number of households, and later we had to do some cancel that policy. So income and asset data is very important for welfare policies, but we had some flaws or restrictions in survey data. We would love to use administrative data, but most of the administrative data, like national tax data and asset tax data, they are collected mainly for taxation. And when it comes to having a database, we did not have proper database. And because they were personal data, a lot of these data was not made available to the people, researchers like ourselves. So many cases, we had to rely on survey data with little access to such data. In the 1970s, Europe started this, and they began registering the entire population, and they added various administrative data based on the population data, and they now have integrated administrative data. And Europe is quite sensitive to private information. In Korea, we say private income is a very highly sensitive information, but Europe thinks that is not a private information. You can even check out your neighbor's income. But when it comes to health, they have a very strict protection policy. In the United States, in the Korea, the United States is now integrating various types of data. They have social security number in the United States, and information can be anonymized, and a lot of administrative data can be added to the data. Last year, 3 data laws has been passed in Korea, and we can connect them to big data. But we have not seen any tangible progress yet in terms of data usage. And let me talk about national health insurance data that we used. Health insurance data is data on income, property of insurance subscribers to calculate the insurance premium. And National Tax Office, Ministry of Administration, 30 public institutions have collected this data, and up until now, their data was used to calculate the premium. But NHIC these days is now developing a panel from 2002 to now. For 13 years, data has been collected to validate the income and property of individuals, and it was developed 2 years ago at National Health Insurance Corporation, and Seoul Institute used this data for the first time for such research. NHIS data, we looked at the Seoul citizens, around 10 million individuals. From 2002 to 2018, we received whole data set, and we need national comparison. So we used 1% of sample data set of national population, which was around 500,000 households. This is a picture of how the data has been related to individual institutions. This is the result. It was our first time using administrative data, and NHIS has provided this data for the first time to our organization, and the administrative process that we had to go through to exchange the data and to enrich the data, well, that accounted for 40% of our time and effort. Since it was first time, it was difficult, but it actually took just 2 months to analyze the data. Let me share the main results. When you look at individual income level of Seoul, the average income of adult workers in Seoul, and out of adults more than 20 years old, 67% had their income, and 2006 it was 36 million. It went up to 40 million.
2,500만 원에서 2,600만 원. 중위소득 같은 거 더 소폭 올라가는 걸로 보입니다.
In 2018, and medium income of adult workers in Seoul went up 6.1%. And then income quintile share ratio of income of adult workers in Seoul was 19% in 2006, but went down 16% in 2018. This is inequality and poverty. This is top 1% of income earners and the top 10%. Based on NHIC data in 2006, 1% had 17% share, and in 2018, 13.8%. This means that income distribution equality has improved and income gap has been reduced. But we could not really trust this result. And we looked at other similar research, and in 20, we had another research, And Professor Kim and Professor Hong, they had similar research, and their results were quite different. In 2000, compared to 2006, in 2018, the income share of top 1% increased, meaning that the income inequality has increased. But we showed the opposite result, and we looked for the reason why. And then we directly analyzed the data from National Health Insurance, but the two professors did some estimation based on the public data, so the methodologies were different. From 2016, and we looked at 12 years of data in panel, and income data of NHIC comes from National Tax Office. And from 2006, National Tax Office has changed a lot of ways in collecting the data related to national individual incomes. After 2006, the accuracy of income data has improved greatly. So based on the government's collection policy, the income data has been improved greatly in terms of accuracy. And when we look at the income share rate, we cannot be 100% sure that they are absolutely correct. This is related to poverty. What we need to pay attention with regards to poverty is that, of course, the poverty share rate is important, but we are seeing a lot of one-person households. In the past, we looked at four-person households average, but one-person households can have a drastic impact on poverty rate. So when we looked at the number of people in the household, the one-person, two-people households had lower income, and their poverty rate was high. One-person households had poverty rate as high as 30%, which was consistent across all the country. The Seoul metropolitan government is now paying attention to one-person households these days, and households used to be the basic unit of economic activities, but with the emergence of one-person households, that would have new implications on our policies. This is related to real estate holdings. Professor Jeong actually analyzed this. I will just to share the results. Regarding real estate, there's the building, houses, land. We looked at different data and national tax-based data because we could not find the real transaction price. Land, building, ownership. From 2006 to 2018, the ownership has gone up across all country. Regarding real estate holding, what is the wealth inequality and real estate price? The blue bars stand for Seoul, the orange bars for across the country. You could say they are the price of buildings. When you look at the transaction amount, as you can see, Seoul had a very higher amount. From 2006 to 2018, the taxation base has gone up greatly for Seoul. Relatively speaking, the graph on the right shows inequality in tax bases. Such inequality is going down even though the absolute amount is going up. This means that, let's say, housing prices have gone up in general, but the difference has been reduced. And there are 25 local governments, local districts in Seoul. And when we looked at real estate inequality, the darker areas are Gangnam, districts, and where the tax basis is really high. In the Gangbuk area, it's relatively less dark. And from 2006 to 2018, the overall trend did not change. The Gangnam 3 districts maintained the highest price level, and at the low, this also shows inequality within a district. Jongno, Junggu districts, these districts had high level of inequality in real estate price. But in 2018, Jongno, Gwanak, Gwangjin, these districts also began to show high level of inequality. And one thing that I would like to mention is that regarding real estate, we looked at national tax base. But the actual price is quite different from the official price. So we combined the tax with the actual transaction price with the tax basis, but real transaction data also had some inherent problems because you have to self-report the actual transaction price, so the reliability of the transaction price is low. And transaction price is only available for certain types of houses. But we also looked at the level of inequality, including the real transaction price. And then social mobility. We talk about mobility, tilted playing grounds, and inequality in our lives. And in order to validate that, in 2006, we looked at young people, individuals aged between 25 to 29 in 2006, and sampled them based on how their labor income changed. The letters are too small, but let me give you the conclusion. The low-income families, in 2006, their income was 23 million, but top 20% youth had 17 million. And Table 4 shows changes in labor income by household income quintile in 2006 of individuals aged 25 to 29 in Seoul. The lower 30% of household income is 525,000 won, and the top 10% of the household income was 18 million won in 2017. The next slide shows the household wealth quintile, and inequality in household wealth was really larger and more pronounced. So there were no significant difference in labor income between Q1 to Q4 in 26. But the wealth gap in household wealth began to increase, meaning that throughout your life, depending on what kind of family you were born into, will continue to have lasting impact on your income level throughout your life. And this shows the impact of household background on labor income of young people aged 28 to 32 in 2018. Household wealth in 2018 had a statistically significant impact on labor incomes in 2018, and household income and wealth in 2006 also had a statistically significant impact on labor income in 2018. Last but not least, this is my conclusion. To wrap up, we still have some flaws in our research, but at the local government level, as a local research institute using the administrative big data to validate the inequality or gap in income and wealth, I think we are the first research center to tackle this research. And we worked with a lot of other institutions like NHIC. NHIC also needed to develop and validate the data accuracy that they developed. So we worked with NHIS, and the data had the inherent advantages of administrative data, but it also had drawbacks. Like we can have access to market income, but because of the national tax policies, daily workers' income or financial assets below 20 million won do not have to be reported to the government. So there is lack of accurate information about the income and assets of low-income people. And we also have a lot of private sector payment, but that cannot be accessed. So we could not calculate the disposable income. So the data inherently had this limit, but depending on how we change the taxation policies and analysis, I'm sure we can make up for this kind of shortage. One more thing to go. What is Seoul going to do? Our research does Seoul welfare survey every 2 years, and it's important that we analyze the inequality using healthcare data, and we'll continue to think about new ways to utilize this data. And when we carry out welfare survey next year, for 3,000 households in Seoul, we'll visit them door to door. But if we can connect them with the income data of the National Tax Office, that would be very helpful. Of course, it could change depending on the policies of the National Tax Office. I look forward to your continued support and interest. Thank you very much. Thank you very much, Dr. Kim Seungyun. It was a very interesting research. Later on, during discussion, I hope I will come back to this question, but when we look at the health insurance, you said that income inequality is being reduced, but this is against the common sense. Can you elaborate on that? And then this research was completed right before the outbreak. So how do you think the situation would have changed during the pandemic? And I'll get back to that in the Q&A. And I will now introduce you to Dr. HaeKyung.
지리 정보를 활용해서 문으로 박사학위.
She has received PhD degree, and currently she is working as my colleague at Seoul Institute. The title of the presentation is Extreme Heat, Vulnerability of Residential Area in Seoul, Space-Time Series Analysis of the Sensible Temperature Using Big Data. She has diverse interest in various fields. Today, she will focus on S-DOT, which is an IoT sensor set, and using that, we were able to analyze the big heat that hit Seoul metropolitan city. Please begin. Hello, everyone. I was just introduced. I'm the third speaker of the 5th session. My name is HaeKyung. I work at Seoul Institute. I'd like to start my presentation about using S-DOT big data to understand the sensible temperature. With the climate changes going on, extreme heat and inequality in urban city continues. People on streets or vulnerable people are exposed to extreme heat, and also the immigrants. There are a lot of people dying in heat wave, and it's likely to be worsened. However, the extreme heat on top of the COVID-19 has created another issues. Seoul Metropolitan City government told everyone to stay inside home, but they said that it's too hot to stay inside a home. We had two extreme heat, and this year was much hotter than last year. The people who were exposed to the extreme heat, they were suffering from the extreme heat, which was much worse than COVID-19. According to the media report, they have nothing to do, and they usually ride a bus and then ride the city. But I don't really know how much impact the heat gives to the COVID-19 virus expansion, but definitely, once again, it would have been much more painful for residents who live in the vulnerable area. Then, problems of extreme heat during the pandemic, especially the vulnerable people, the low-income group who have no air conditioner or house vulnerable to extreme heat, or elderly people close shelters for elderly physically vulnerable to heat. What can we do? If you look at here, as you can see, it was all closed down. The shelter were closed down for elderly people. Therefore, the climate changes has actually created more frequent extreme heat, and we have no choice but to improve the living condition. But Seoul Metropolitan City government's budget is limited. Starting from the most vulnerable area, we need to improve the living environment. So, the Seoul Institute, what we did was to analyze and assess the areas vulnerable to extreme heat in Seoul for phased improvement. So what we did was first space-time trend analysis and vulnerable factors analysis, and then adding these two, we have come up with a mapping of extreme heat vulnerability. And thus we can find out the priority areas for improvement in residential environment. Frankly speaking, during the last Big Data Forum, we have analyzed the sensor data, but last year we only analyzed 1 day of extreme heat, and it was a space-time analysis. Mostly we analyzed the space, but this year we have utilized more than 1,100 sensors installed in 250 places, and we calculated not only the space but also time analysis of the extreme heat. The definition of sensible temperature, what is it? If the temperature continues much longer, then we categorize this. So more than 33 degrees or higher maximum daily temperatures are regarded as a sensible temperature. And using sensible temperature, we focus on temperature of human fields in urban living, not as a natural phenomena. Definition is day of the exceeding temperature of 33 degrees for 2 consecutive days. And in 22, KMA changed the criteria exceeding sensible temperature of 33 degrees. Sensible
토지 유형별로 그 주거 지역만의 기온 특성이 있었기 때문에 저희가
each area has different. Sensible temperature is calculated by temperature, and relative humidity is more.
요소로 이 세 가지를 보게 된 이유는 기존 연구 이 폭염의 빈도 중요한 요소라고 언급.
Frequency and strength of heat wave is really critical, and if the heat wave lasts for a long time, it's going to be
판단을 살펴보게 되었는데요. 다만 이제 탐색적으로 살펴보는 것이기 때문에
we need to be very investigative, and we have to focus on the local needs. Let's look at the frequency of extreme heat. The most frequent extreme heat, duration and start and date of extreme heat. As you can see, each region had different duration and start and date of the extreme heat. And sometimes the heat lasted as long as 32 days.
나타났습니다.
So we can see the duration and start and end of the extreme heat. Now the intensity of extreme heat. The highest intensity was 7 degrees. As you can see here, 7.5 was the highest one. The difference between the maximum and minimum was 3.5 degree. So this was the difference between the highest and the lowest. So this one, once again, we came up with FDI plot of extreme heat, the high intensity or long duration area, and we try to understand the high frequency. On average, it was hard to find the insight, but in every dot, we try to understand the durations, and the maximum intensity, it is the duration. If it's longer, once again, we were able to confirm the fact. Now, we try to compare the trend. Long heat wave, when it falls in highest intensity, we try to understand that. Of course, this is exploration, so difference in the humidity can be sufficiently affect the sensible temperature gap. And the gravity of the extreme heat was very different. Now let me talk to you about the space-time analysis of extreme heat. We wanted to understand 3D space, the time data, and analysis process, and we came up with a 3D visualization of space and time data. Let me briefly explain how we have done the analysis. 1,100 sensors were installed, and this dot shows the locations, and S dot time series data shows the humidity and temperature per hour. And we have come up with the time scope, the data, daily maximum sensible temperature of 1,100 S dot. We try to analyze the cluster, and up to 3 months, the location with a similar value across the time will be clustered together. So, space-time cube data, including time and space information in one file, analysis considering both time and space at one, is possible. Now, just visualizing of space and time data was enough, but if you look at here, it's July the 1st and all the way until the August 31st, we try to understand the space-time trend of the daily highest sensible temperature in Seoul. In 2021, extreme heat in Seoul was mainly concentrated between July 20 and August 10. I told you that I have done the cluster analysis, and you can see here the similar cluster were put together, and I have labeled according to the means sensible. And then you can see here that I have categorized into high and the middle high, middle low, and low. So this is how I have put them in one cluster. So I try to understand the daily maximum sensible temperature. Then what's the difference between the clusters, the heat? So the low cluster and difference was 2.7 degree between the minimum and the highest. And in some cases, it was around 33 degrees. And each cluster has a different characteristic. And high and low, the difference was almost 2 degrees. The frequency was almost 21 days. So definitely each cluster has a different characteristic. That was what I found. But frankly speaking, 1 degree or 2 degree, we don't know if it's huge. The meaning of the difference of the 1 degree to human being is not felt keenly. So I tried to understand the existing analysis. The mortality rate is increased by 15.9% if the temperature rises by 1 degree further when it's about 29 degrees. When the temperature rises by 1 degree, stroke death increases to 2.3 to 5.4%, and incidence of acute cardiac arrest increased by 1.3%. A 1 degree temperature rise was associated with a significant increase in mental health related mortality and morbidity. If that is true, then how well does the cluster represent the actual reality? I try to compare the urban sensor value with the cluster average. You can see the dotted line shows the average of the cluster, and the straight line shows the original value. And in 3 months, I found out that the trend is quite consistent. So comparing the average value of the high area cluster with the value of 1 point of S-dot to verify how well the clustering is done. Now, comparison with the FID plot and cluster, especially the Eunpyeong and Mapyeong, these two residential area, we try to understand which cluster it belongs to, and they belong to high cluster, and the intensity was a bit lower, but still the duration was the highest, which is Dongjakgu. They belong to middle to high cluster. So we cannot generalize this, but the high intensity definitely make the cluster belong to higher cluster than the duration. Now, let me give you the analysis of the extreme heat vulnerability. Variables are like people above 66 years old or below the 13 years old, because the elderly people and children have difficulty in adjusting their body temperature. They are very vulnerable to the heat, and they come to home really early because these young children come home. So you have to understand that this elderly, infant child, bad body temperature controllability, physically more vulnerable, elderly and school child, they retire or going home early, spend a lot of time at home on a heat wave daytime. Second, we try to analyze by housing times. The houses built before 1989, more than 30 years, they are classified into old defective houses. And among the houses that were built more than 30 years, especially the multi-household or old condition, they are vulnerable due to low energy efficiency. So these two are regarded as aging housing type. Last, vulnerable variables are depending on the income level. So low-income household, this low-income household, they don't have air conditioner or they can afford to pay the electrical bills, so they don't switch on the air conditioner. So once again, we try to analyze the hotspot of the household that cannot use the air conditioner. So extreme heat vulnerability map, you can see the pink colored one are the area where three factors all apply. The green colored area are the area where two factors are applied. So you can see in this map, according to the temperature, the high cluster, and the cross area are the area where we need to improve the living condition. So the area of the most vulnerable to extreme heat and high cluster, we identify them as a first priority area of a need to improve. First priority area is, as you can see, because we have analyzed the cluster, and we can clearly say that, and this is quite sensitive. So if I give you the name, Gwanghee-dong and Changhwi-dong, these two areas are the most vulnerable areas. And we have confirmed through roadmap, and as the photo shows, this is how they look like. Among these areas, redevelopment were already carried out. The second highest priority is, as you can see, middle high cluster area, and the third area is, of course, the second vulnerable area. In the similar way, within this area, we can put a rank. So policy-wise, we need to put an emphasis in redeveloping this area. So this is my conclusion. In the summer of Seoul, there were regional differences in the intensity and duration of extreme heat due to different environments, temperature, and humidity differences. Time series analysis result, there was an area that was the hottest and most vulnerable to extreme heat, including demographic, housing, and income factors. Thank you for your attention. That concludes my presentation. Thank you.
고맙습니다.
Thank you very much, Dr. HaeKyung. Very interesting. This is my second time to listen again. Summer was really hot this year, and as Dr. Park, it was not included, but Seoul Metropolitan City, we plan to expand the installations of the sensor, and second by second unit, we are gathering data and we need to clean the data. And Dr. Park did not talk about the cleaning big data, but she did it again to make a presentation, and I truly appreciate that.
Next speaker is Dr. Boyeong. She is currently working in a project and at Maron Institute of Urban Management and a visiting associate professor at Columbia University in New York. Dr. Hong is an expert in urban planning and urban informatics. And then we will hear from her again in the discussion session. So how big data analysis can contribute to providing better urban services.
적으로 탐색하고 계신 것 같아요. 오늘은
Now, she is going to talk about how to overcome the inequality in our society by analyzing the mobility data. Please, Dr. Hong, start your presentation.
Hello, everyone. First of all, thank you for your time and thank you so much for joining this session. Let me introduce myself first. My name is Boyeong, currently an associate research scholar at NYU Mellon Institute of Urban Management and a visiting faculty at Columbia University in New York City. Let me share my screen first. Although it's over Zoom, I'm very excited to be here today to give this talk, the role of urban analytics to fight neighborhood gaps. Today, I'd like to focus on measuring neighborhood gaps at the granular level based on large-scale mobility data. One of examples, this video shows human mobility in Greater Houston area during the Hurricane Harvey in Texas, 2017. Before the hurricane, we can see clear patterns of highways, commuting patterns, and normal activities in and out of downtowns. But when hurricane hit Houston on August 26th, basically, normal patterns of the city suddenly disappear and there are way less and sparse activities across the city. So this data with the proper computation represents neighborhood level response and evacuation patterns. It can be directly used for measuring hurricane damage and resiliency associated with neighborhood climate gaps. So we're probably now in the next phase of urban planning, and large-scale data in urban analytics can tell a story about urban dynamics in neighborhood gaps with respect to either everyday normal life or urban crisis. I'd like to mainly talk about a very timely research about the COVID-19 pandemic. Briefly, this research used large-scale geotech mobility data and machine learning technique to identify significant neighborhood disparities in neighborhood responses to the COVID-19 pandemic, which is very closely related to varying public health outcomes. This research has been done in partnership with experts in epidemiology, and it has been published in one of the most renowned top-tier journals, PNAS. So look at those two images. I mapped a very small random subset of smartphone ping data without any computation. The left one is before COVID, and the right one is 2 days after the stay-at-home order declaration. It clearly shows a significant change of mobility in neighborhood activity levels in Astoria in New York City. Again, mobility data tells here first urban dynamics in neighborhood activities. Despite universal policy implementation, the impact in response to the stay-at-home order is not uniform across neighborhoods, and this has contributed to further disparities in risk of infection. Also, there have been disproportionate public health impacts on vulnerable communities in terms of COVID cases and death, which may or may not be closely related to social distancing behaviors. We have had a hunch, but it has not been proved. Some previous studies often focus on poor spatial resolutions, such as county or state level, because of data availability or computational constraints. However, social distancing behavior change and public health interventions, it should be measured and examined at the scale of individual neighborhoods. We know there is a significant neighborhood gap, and understanding this gap at scale, it would provide critical insight into the design and implementation of more effective and equitable public health policy. So this research project aimed at developing a method to identify and measure neighborhood gaps with respect to social distancing and public health outcomes, focusing on New York City case. This study firstly quantified neighborhood activity at higher spatial and temporal resolutions using large-scale location data mining. Then this study tests whether and to what extent behavior responses to social distancing policies vary with neighborhood characteristics based on computational modeling. The main data resource for this study is an anonymized large-scale geotech smartphone data provided by BAMPath, which is one of the third-party data providers. So it's basically smartphone ping information collected from more than 200 different applications, but data doesn't reveal any specific app information. The initial data size is 22 terabytes, not 22 gigabytes. And this study only focuses on the period from February through April 2020, so covering before, during, and after the stay-at-home order. After filtering data based on the New York City specific bounding box and removing non-valid users, the data covers approximately 13 million unique devices with 23 million pings. Then, in order to avoid tracking of individual devices, all data points were spatially and temporally aggregated at 250-meter grid cell and 5-minute interval. Those aggregated data points were integrated with land use rasterization information to classify individual pings into 4 different groups of neighborhood activities: residential, non-residential, outdoor, and vehicular activities. Many COVID-19 related studies have focused on the relationship between COVID-19 infections and population size or population density. Most research are based on census population data, which does not represent actual activity density in the neighborhood due to its static nature. So this study defined and developed an exposure density concept. Exposure density is a measure of localized activity occurring in areas that can be associated with an increase in risk of exposure to others that may be infected. Basic assumption is that people who change their behavior dramatically and stay home have less probability of close contact with infected people. So this exposure density concept mainly takes into account non-residential and outdoor activities. So mathematically and computationally, exposure density measures the number of unique devices in a given geographical and temporal unit by land use type. So for the first step of measuring exposure density for this study, I computed the hourly number of unique devices in each 250-meter grid cell and the corresponding land use category based on the raster cell. So this time series plot in the slide shows the citywide non-residential and outdoor activity change over the time from mid-February through the end of April last year. So overall, we observed an approximately 20% decrease in neighborhood activities outside of residential buildings after the stay-at-home order. This slide shows a descriptive picture of neighborhood activity change over the time period in the city based on the exposure density metric. So first, time series plot describes average neighborhood activity by land use type by 250-meter grid cell before and after the stay-at-home order. So top 2 plots are citywide average neighborhood activity volume change, and bottom 2 graphs are citywide average neighborhood activity proportion change. Red lines are residential activities, green is outdoor activities, orange is non-residential activities, including offices or commercial spaces, and purple lines show vehicular activities on the highways and the major road without pedestrian access. As you can see here, after the stay-at-home order, overall neighborhood activity volumes decreased, right? And weekday 9 to 5 patterns have disappeared. So for the activity proportions, residential activity proportion has been dramatically increased, while other activity types decreased. The right map shows a spatial pattern of the exposure density change by 250-meter grid cell based on the activity volume change of non-residential and outdoor activities during the two time period. So 2 weeks period before the COVID and after the stay-at-home order. So higher density neighborhoods, including most of Manhattan, downtown Brooklyn, Long Island City, decrease exposure density a lot, but outer borough neighborhoods show rather increasing neighborhood activity after the stay-at-home order. To understand disparities in exposure density and behavior responses to social distancing mandates across different neighborhoods, I applied an unsupervised machine learning clustering algorithm based on a pre-post comparative analysis. I extracted exposure density subsets for 2 different 2 weeks period. So the pre-impact period, so February 16 through February 2019 last year, and the post-impact period, March 29th through April 11th last year, to measure changes in exposure density before and after the stay-at-home order. In order to take into account both the absolute change in activity volume and the change in the proportion of activity types, a total of 6 input variables were created for the zip code neighborhood clustering analysis. The neighborhoods are classified into 5 different groups. This slide visualizes the spatial patterns of the clustering output and time series of neighborhood activity and where that activity is occurring by land use type. So again, red is residential, orange is non-residential, and green is outdoor activities. Group 1 and Group 2, they're primarily located in Manhattan, in downtown Brooklyn, and they represent substantial changes in exposure density after the stay-at-home order. The average activity volume change for Group 1 and Group 2 is minus 56.5% and minus 33.5% respectively. And it means that these 2 neighborhood groups experienced significant declines in normal activity levels across all land use types during the pandemic. And Group 3, total 43 zip codes neighborhood, it shows a 19% decrease in exposure density. Although we see a marked outflow of residents, these neighborhoods maintain a stable proportion of activity between the different land uses. So this indicates that residents who remained in these communities largely maintained their regular behavior patterns. Neighborhoods in the Group 4 cluster, they have stable activity patterns over time. However, this neighborhood did not see a significant outmover population. So I labeled stable group for these communities. And lastly, in comparison to other clusters, group number 5, neighborhoods, it demonstrates a 20% increase in local activity volume for residential activities and a 7% increase in outdoor activities. So in addition to increasing overall neighborhood activity volume, residents staying in these neighborhoods are found to shift activity to residential buildings by 10% and away from non-residential and outdoor activities by 6%. While non-residential activities are found to decrease as a proportion of these activity types, the increase in the overall volume of activity leads to a net increase in exposure density compared to the pre-COVID period. And this slide shows descriptive statistics of neighborhood features for each group, and it reveals very distinct neighborhood profiles based on changes in exposure density over time. So for example, most neighborhood in Group 1 and Group 2 overflow groups, they have a higher percentage of younger, non-Hispanic white residents, relatively small average household size, and household higher incomes in education attainment. Group number 3, stable outflow communities. They have higher proportions of racial and ethnic minority and lower median incomes, as well as significantly higher proportions of renter households and those without health insurance coverage. And additionally, a greater percentage of employees in these neighborhoods work in retail services and healthcare support occupations. essential businesses that were not required to close during the outbreak. And group number 4, labeled the stable group, it comprised socioeconomically vulnerable households in a high proportion of racial minorities. The second lowest median income, large average household size, high unemployment rate, lower education attainment, and a large share of healthcare support workers. Also, I found that the relatively modest change in exposure density in the stable groups is associated with significantly higher infection rates. So in particular, the stable neighborhood group, which is group number 4, it shows the highest case rate, death rate, and positivity rates in the city. In group number 5, outer borough communities, this group has the highest proportion of elderly population, the largest household size, moderate incomes, a relatively lower percentage of racial and ethnic minorities, and a significantly higher home ownership rate. So this indicates that activity in these neighborhoods where housing density is the lowest in the city, they became more localized compared to the pre-COVID. The effect of this local activity was an increase compared to the pre-COVID level in the probability of coming in contact with others outside of the household or family unit. As a result, this group number 5, they experienced the second highest infection rate, even though they have the relatively low built environment and population density compared to the other neighborhoods. And lastly, I evaluated the effect of neighborhood change on COVID-19 infection rates for the neighborhoods. So I firstly developed a log transformed bivariate regression models based on relationship between exposure density change and 4 different infection rate metrics: case rate, death rate, positivity rate, and fatality rate. So there are clear relationship between exposure density and case rate, death rate, and positivity rate, but as expected, not being a statistically significant determinant of mortality rate. So based on the simple modeling, I found that if all neighborhoods in the city reduced exposure density by 10% as compared to normal activity levels prior to the stay-at-home order, approximately 29,000 COVID-19 cases could have been avoided and almost 3,000 lives could be saved through the end of June last year. This research also developed multivariate log transformed regression models to identify any significant effects of exposure density on infection risk, controlling for neighborhood characteristics. So I combined both outflow cluster groups like group 1 and group 2, and used a stable neighborhood group, which is group number 4, as the reference case for dummy variables. After accounting for neighborhood covariates, I continued to observe statistically significant coefficients for the exposure density variables. So neighborhoods that reduced exposure density show a 44.3% lower positivity rate compared to the reference group. For outflow neighborhoods that maintain the distribution of activities across land use types, the output shows a 23% lower positivity rate. So these findings provide additional empirical evidence for the effectiveness of social distancing as a non-medical intervention strategy to reduce COVID-19 spread. And it reinforces that proactive neighborhood behavior change, it can help to prevent transmission of the virus during the pandemic. In terms of sociodemographic features, as importantly, race and ethnicity, age group, and socioeconomic status, they are found to have statistically significant effects on neighborhood infection rates and disease outcomes. Neighborhoods with larger proportions of minority and lower income population are more likely to be at risk for virus transmission. To recap, this research project analyzed large-scale geolocation data and granular land use classifications to measure high spatial temporal neighborhood activity level and exposure density. So the findings from this research demonstrate distinct patterns of activity before and after the stay-at-home order across neighborhoods in the city. So these neighborhood patterns are clustered into 5 different distinct groups, each exhibiting statistically significant differences in socioeconomic, demographic, and built environment characteristics. The variation in exposure density has a direct and measurable impact on the risk of infection. In neighborhoods where exposure density decreased the most, they have lower rates of infection, positivity rates, and death rates per capita, controlling for other covariates associated with social determinants of public health. The communities hardest hit by the virus, they were in the stable neighborhoods where residents faced multiple challenges and risk factors. These communities have the largest proportion of racial minorities among the lowest median incomes and the lowest rate of health insurance coverage. These compound risks resulted in these vulnerable communities facing the burden of the highest rate of infection, death rate, and positivity rate in the city during the study period. So even though the universal policy program has been implemented to all neighborhoods, responses to this policy were totally different across neighborhoods depending on their circumstances, probably social norms and other external factors. This large-scale data analytics research demonstrates a clear neighborhood social distancing gaps, resulting in significant neighborhood public health gaps. This novel research method and findings have clear contributions. First, a developed computational approach to measure exposure density at higher spatial and temporal resolution is scalable. So this method and computational model can be applied to other cities or other events to understand neighborhood activity patterns at scale. For example, this approach is scalable to any aerial unit of interest. This research utilized a 250-meter grid and aggregated to the zip code level to match the geography of reported COVID-19 data. However, it is possible to apply the same methodology and same metric to point locations or grids of any size and then aggregate the units to other common administrative or political boundaries, such as census tract, counties, and metropolitan areas. And second, this research provides a foundational findings of neighborhood gaps. This research demonstrates the significant disparities in behavior responses to social distancing and health outcomes for racial and ethnic minorities and lower income households. And this objective findings contributes to theorize neighborhood inequalities and gaps regarding different urban phenomena. And lastly, the study contributes to suggest a tool for the design and evaluation of equitable and targeted public health interventions based on hyperlocal exposure density measurements and measured neighborhood gaps. So instead of applying a universal policy program, the city government can adjust or add on their policy program after quantifying neighborhood disparities. As this diagram shows in the slide, targeted and localized social distancing policy interventions, it would break or at least weaken the linkage between neighborhood social demographic disparities and social distancing gaps, or the linkage between the social distancing gaps and the public health gaps. So thank you so much for listening. I am happy to answer any questions. 감사합니다. 질문은 한글로도 가능합니다.
잘 들었습니다.
Thank you very much, Dr. Hong. It was very extensive data with a very simple and clear idea, coming up with a very clear conclusion. It was very impressive. Let us move on to discussion right away. And Dr. Bruno, Dercon, and Dr. Hong, are you joining us online? Yes? So I would like to introduce you to the discussants. First, Professor Kang Myung-gu from University of Seoul. He is the head of Smart City Institute at the university, and he is active in World Bank and Urban Planning Society. And he has published 2 books recently. And second discussant is Professor No Seung-chul from Hanshin University. And based on various land use, migration, land property, he's doing a lot of active research. Next discussant is Dr. Jung Mi-ae, Research Fellow at Science and Technology Policy Institute of Korea. Her area of research is very much related to innovation. At Science and Technology Policy Institute, she has been studying regional bipolarization in COVID-19 pandemic. Thank you very much for joining us today.
Before we begin the discussion, I would like to ask or confirm a simple question and also hear your views. Will that be okay? First of all, to Dr. Kim Seungyun, I have asked you a question, and to Dr. Boyeong, in your research,
You have talked about the relationship between social distancing and inequality or disparities. In Korea, we wear masks all the time. So when it comes to exposure density, do you think it can be relevant in Korea where we wear masks all the time? Am I the only one asking questions here? Why don't we collect the questions first and then get the answers from the speakers before we move on to discussion?
네.
well, my name is No Seung-chul, professor of Hanshin University. Thank you very much for speaker for great, outstanding presentation. The moderator asked me to say a very short question. I would love to have like whole full day discussion with all the speakers, but unfortunately I cannot do that. Dr. Bruno Dercon, well, your presentation was superb. Big data and AI could be our hope for the cities, but at the same time, you gave us example of Matat and Matatu, and that example or that case, especially in the process of creating the application, you talked about the residents' participation. So UN Habitat went to that place and carried out the project, and you completed the project. In the process of that, the Nairobi resident, how much do they participate? Can you elaborate? I just wonder about the citizens' participation in Nairobi. And now, Professor Boyeong, I loved your conclusion. You talk about unique device expression, but what do you mean by unique device? When you say device, are you talking about non-human being or mobility data or the device that produced the mobility data? Can you clarify? I'm a bit confused.
그럼 발표 순서대로 좀 답변을 주실까요?
So, Bruno, Dr. Bruno, would you like to begin first?
Thank you for the kind comments. And it's a very relevant question. Participation in big data programming and initiatives, when I provide the message about people-centered smart cities, then participation is obviously important. In the case of Nairobi, yes, of course, it worked with participation, especially with the operators of the Matatu. The Matatu are these small minivans, which you so often also see in Asia, and they are a mixture of individually owned or small cooperatives. It's a very chaotic business, and that's why it thrives in that chaos, responding to demand, haphazard regulation, unclear trajectories. But they are visible. They are there in the city. They are driving around, and everybody knows everybody. It's a network. And this project, of course, could make use of that visibility of these vans and these operators and these small cooperatives being around, and build in the sensors and connect the mobile phone data, and in only a year or 18 months time build up actually that wealth of data to finally have the transportation map of Nairobi, which is not an official map. It's a map created by the participation of all the operators. The other point was that it becomes a very nice example of people-driven big data because the reception by Nairobi citizens was so positive. Out of the blue, a full map, as nice, and I give a poor representation of this nice transport map that they now have on their phone, but as nice as a good transport map in Amsterdam or Tokyo or Seoul. Yeah, it looks in the same fancy way, but it came out of big data and participation. So it worked. And the final point is that, of course, there are other layers of research and academic collaboration. And then in that respect, the inequality data, the income data is, of course, from statistics. It's not from participation. And it's the layering that creates a new narrative, new perspectives, and of course also that vision that smart mobility with either with minivans for poor people as in Nairobi, or with electric driverless cars in the future cities is a blessing and is a problem at the same time, because people like it in an instant for a marginal gain, but it does not bring sustainable transport, less cars, less pollution, nor it brings, in the case of Nairobi, solutions to the severe spatial inequality, the severe segregation between neighborhoods. It actually makes it more permanent. So all these things are interesting, and it's this layering of information that brings new insights and new possibilities for policy. Thank you.
고맙습니다.
Thank you very much. I've received 2 questions about data related to social income inequality. Income inequality, I mean, the people who are rich makes more money, and people who are poor makes less money. And inequality seems to be reduced now because from 2008, Korea National Tax Office began identifying income levels of individual business owners. And before that, individual business owners' incomes were not properly assessed. They account for 30% of income earners in the Korean economy, and they are now using a lot of credit cards. 10 years ago, when we bought $1 product, we could not use credit cards. But these days, we use credit cards even for small amount transactions. So the individual business owners and small business owners, their income have been more transparent. So instead of being underestimated, they are getting higher or more accurate evaluation of their income. So low-income people's income have been made more transparent, and that makes it seem as if the social inequality is being reduced. So it's a matter of tax collection policy change. The most important question is, after COVID-19 outbreak, but the recent data in my research was from 2018, and COVID-19 broke out after that. And what about the inequality after COVID-19 outbreak? I think there are 2 ways to answer this. We could look at other data, and we are seeing disparities or inequality deepen in our society, and we are actually feeling it in our day-to-day lives. But can it also be proven in analysis? Last year, when we did the household census, when people were asked if their income changed before and after COVID-19, the income difference was not as big as we imagined. Statistically, we have to find out the reason why, because we're feeling very serious level of inequality, and also inequality between generations seems severe, but the data is too early to show that disparities. Thank you very much. And you're saying richer people probably have hidden their income. And now the indices or data are being globally standardized. So the data are being normalized. So going forward, inequality data must be observed and followed. That seems to be the conclusion. Dr. Hong? Let me answer the question, social distancing and its relationship with inequality. In the case of Korea, well, the situation was different. But in New York, in the initial stage of COVID-19 outbreak, it had been hit hard, and the government imposed very strict social distancing rules, and everybody had to stay at home. At that time, pharmacies, restaurants, public transportation, except for the very essential services, everybody had to stay home. And those who cannot work from home, especially low-income people or who had to go to work, they have been made vulnerable to infection. And that led to lower income people, more vulnerable people, especially people who are not covered sufficiently with health insurance because of their profession, had to continue to go to work, and they have been exposed to virus. And this deepened those who cannot work from home, and they were scared of being infected, and sometimes they decided not to go work, and then they were fired. They were fired from work. So people, depending on the type of occupation and their health insurance coverage, well, the personal choice mattered. Personal choice against social distancing led to deeper inequality. And Professor No has talked about asked question about unique device. If I spoke in Korean, I was afraid I would not be able to communicate myself fully. So by unique device, it's the mobile phones that individuals have. So in the case of data, recently we analyzed the COVID data, but before that we have been studying the data from 2018. And then we looked at how much information has been collected, how many data sets from mobile phones. Was it individually owned data? Mobile phones were automatic machines, so we had validated that. And for New York City research, we only looked at individual mobile phones or individually owned smartphones. It was a very good and thorough answer to the questions. Now we are going to move on to the discussion, and I would like to ask the discussants to share their ideas and comments. How should we go in terms of order? I think Professor No should go first.
Dr. No first, and then Dr. Chung, and finally Professor Kang Myung-go. Will that be okay? Yes, please start, Professor No. Thank you for asking me first, because if I become the third discussant, I wouldn't have much time. So thank you for giving me the opportunity. Well, the topics that we are addressing is extremely important. I feel like this is like water flowing naturally, because we've been talking about the overall Seoul metropolitan area, inequality existing in Seoul, mentioned by Director Kim, which was once again followed by how we can identify the challenges and issues using the data source that we have accumulated. And then finally, it was mentioned by Professor Hong and Dr. Park about the application and utilizations of big data, whether it is economic sector or in the healthcare perspective. There are definitely gaps and also disparity, and especially during the COVID-19 era, how much the inequality and gaps in COVID-19 are affecting the cities. So it was well mentioned. And finally, Dr. Bruno Dercon, it was great because despite all the challenges that we are faced with, still big data and big expectation, and once again, the digital transformation, all of this is giving us an opportunity. It is enhancing the life quality and giving us hope so that everyone can enjoy a happy life. So this was like a flow of a water, giving us finally the conclusions of happiness. So I really enjoyed the 4 presentation. Although we had the 4 speakers, but I sincerely hope that the 4 speakers represent the trend that is happening in the urban city. So that was my thought that popped up in my mind while I listened to the 4 presentation. I'd like to pose a question to speaker one by one. Dr. Bruno, you mentioned in your presentation, you partially answered my question as well, but let me ask question again. Big data, AI technology, it creates city development, sustainability, and also the resilience are beefing up, strengthening, but and also big data and AI is helping vulnerable people to enjoy better life. But during your presentation, you keep emphasizing the importance of governance. So from the governance perspective, what kind of role should be played by city government and urban government or the central government? What should they do? And you share the example of Nairobi or developing country. What kind of future direction, what kind of preparation should these developing countries have? Now, advanced country with really excellent digital infrastructure, what should they do to resolve or to overcome the inequality? Do you have any idea or any advice? I'm sure that you have a lot of experiences, a lot of case studies, so please share your advices. Please forgive me for asking one more question. And, well, my question goes to Professor Hong. Very short question. Well, during the COVID-19 pandemic, people are suffering economic difficulties, and a lot of our focuses are, especially including the central and city government's policies, are focused on the vulnerable people. But you talk about stable group. You mentioned several times that we need to put a great emphasis on stable group. But stable group showed no movement at all. And were they always stable group even before the COVID-19? Or now's the time to move around, but are they still stand still and just show a stable group? And why are you referring them during the COVID-19 era? What are they doing? And stable group policy-wise or city urban planning-wise or city function-wise? Do you have any cases of New York? Probably you've been studying a lot. So regarding the stable group, if you have any comments, please let us know. So should I hand over my microphone to whom? Yes, that's all. Thank you.
일단 저희 답변을 갖다가 좀 모아서
We'll give the speakers a chance to answer all the questions after all the panelists have taken their turn. So, Dr. Jung Mi-hye, would you like to go next? Thank you very much. I'm Jung Mi-hye from Science and Technology Policy Institute. Our institute studies economic and social policies based on science and technology. And I'm doing local innovation-related research. And what is the role of science and technology in promoting the growth of local community? That has been the focus of our research. In today's forum, I am reminded that science and data technologies can play the role of a system for local growth. And in our field of research, we need to continue to develop these technologies. In our research, we did not study that much about bipolarization or income inequality. But I think I'm invited here because of one of the research that we did, like regional bipolarization in the pandemic era. It's part of the future research that we do every year. Since last year, our institute has been studying the future vision of post-COVID era, and the theme of this year was bipolarization, and I focused on local, regional bipolarization or local inequalities. And in Korea, the biggest bipolarization exists between Seoul metropolitan area and other remote areas. And also there are local hub cities, rural areas, fishery areas, and also bipolarization within cities. In our research, we looked at Seoul metropolitan area versus non-Seoul metropolitan areas. And we've compared with OECD data, and compared to OECD, Korea's bipolarization is not the highest level, but relatively, when people feel this, regional disparities or regional gap, people feel it very strongly. That is mainly because we have gone through intensive growth rate after the Korean War, and we have developed our economy based on export, and the policies has been responsible for regional disparities. And this leads to political differences and political gap. And the previous government administrations tried to reduce the inequalities or bipolarization. Regional bipolarization could be a source of social conflict. In terms of inequality in income and population, and also education, culture, welfare, so inequalities are presented in various aspects of our lives. And on top of such inequality, COVID-19 has added difficulties to the vulnerable groups of people, creating a vicious cycle. And our research focused on this. In our research, we looked at global trend monitoring tool and data from Korea media companies. And we looked at 5 themes for post-COVID era. 5 themes were income, population, education, culture. Very broad 5 themes. And for those themes, we've gone through a citizen workshop to identify some of the future plausible events or incidents. When we looked at these plausible future incidents, there was high level of anxieties and concerns about digital divide. And people were most concerned about digital divide or problems that can occur to elderly people and young people in local areas being degraded to platform workers, and lack of accessibility to healthcare and medical services. But this was also related to depending on how technology is used. They also showed some optimistic that these disparities could be reduced by using the technologies in the best way. Urbanization, industrialization, or can be concentrated in certain regions, and local bipolarization is a byproduct depending on how we access technology utilization. People seem to believe and be optimistic that their future could be better by using technologies. Cluster policy is one of our major innovation policies. Cluster policy is related to regional inequality and imbalanced growth theory tells us that, of course, you can grow by concentrating things. And knowing that, in order to expand growth, if we focus on I think we should continue to do concentration strategies. But on top of that, we have to care more about social safety nets so that we can continue to resolve bipolarization issues. So we've talked about urban inequality, big data, smart technologies. And what we have discussed today could be an alternative to resolving imbalance in our land use. Thank you very much.
When we talk about inequality among the regions within the cities, inequality, disparity, the gap, we need to detect, try to dissolve that. So we can definitely get a lot of ideas and advices. Last but not least, Professor Kang Myung-gu, please begin your discussion. Hello, everyone. Thank you very much for inviting me here. First of all, I'm very pleased to witness that we are having this kind of discussion. I'm so grateful because today's session is so meaningful. And at the same time, there are two ideas that appear in my mind. And I'd like to share that with you first. Very vaguely, we thought about this concept, or we had these narratives about the big data or the cities or urban life. But now, using big data as a tool, we are analyzing the city itself, understanding urban life, and this is a huge change. The impression that I had is this is like whether the sun is rotating around the earth or is earth rotating around the sun. You know, we had two different views, right? When you look at the stars, but after we developed the telescope, after we have accumulated the data, we're able to prove using science that the Earth is the one that moves around, rotating around the sun. So it's a similar thing, I believe. We had this vague idea, but now finally accumulating the big data and analyzing the big data, finally we are able to prove scientifically with evidence. And instead of relying on our feelings, our senses, we have this concrete proof, evidence, fact, which are gathered through big data. This is a quantum leap from the past. In light of that, I think what we are having right now is a really meaningful. And second idea that appears in my mind is now's the time that we finally started everything. So since we took the first step, we need to go a long way. And we've been talking about big data, how to use them for a long time. And on the horizon of having this discussion, we thought about DIKW model. And what I mean by DIKW is start from data, we extract information, and from information, we get knowledge. And based on knowledge, we can come up with a future wisdom. So the first word makes these acronyms. Now, the data itself, we have affluent, abundant data. And that's the first step. But from now, we have a lot of work to do. We have a long way to go. So since we have a data, we need to get knowledge, wisdom, and everything. And how can we do that? We need to make a great performance. So once again, this idea of having a long way to go appeared in my mind. I'll give one example. I think it was Dr. Hong who mentioned about it. The data in New York, she talked about that. The mobility data, she said that she used that, but depending on the sources of those data, she came up with a different result. Like you used the word unique device, like mobile phone data. About 10% of the sample, she did the research, and then she came up with a conclusion. So I thought about my own life, my daily life. You know that because of the COVID-19, I stayed at home. But usually once a week, I went to a wholesale market, like a supermarket once a week, and I bought a lot of things at one time. But as I work at home, I don't go to a large scale supermarket, but rather a mom and pop store right next to my home, which means that I don't meet people that I used to meet inside the supermarket. Is it because I don't go to the supermarket, or is it because I go to the mom and pop store? Maybe it's because I don't move much. Maybe it's a mobility exposure. Then how should I use this mobility exposure? So that also thought came into mind. And other people talked about the inequality or distributions, or all of you talk about these gaps. But I think we have tons of work to do until we come to the final conclusion, why inequality happens, how we can resolve that. So as Dr. Park mentioned, what we are facing right now is an exploration stage. So we need to explore many things. But instead of making a quantum leap into the future, we need to take a step-by-step approach. And as we take step-by-step approach, we need to explore more, identify more, understand more, coming up with more meaningful conclusions, and then we can take the next step. So we need to understand the implications of every single thing that happens around us. When we do that, then we can step-by-step get the information, use that as knowledge, and then finally we can get that and use that as a wisdom. So that's my conclusion. So that's all. Well, if my microphone comes back, I will talk more. Thank you.
Thank you. You are saying the Seoul Institute is doing a great job. Yes, that's true. There is a very high level of interest for this session. We have already received several questions from the online participants. Most of the questions are covered during the discussion. And let me also deliver some of the questions that were not covered before we wrap up. And because of the COVID-19, I think we need some study into social economic aspects of the citizens' life. What kind of data and research is Seoul City carrying out, and how are the data managed in terms of their quality? And Director Kim, you have been designated as the person to answer this question. Now, given the characteristics of the question, I think this question comes from somebody who's working at the Seoul Metropolitan Government. If the stress level of Seoul citizens can be shared as smartwatch, if we can develop some kind of stress level map for the city, what would be the government policies and legislation for the security level of such information? And I believe Dr. Bruno Dercon has shared some relevant question about acquisition, accessibility of such data, and how he has handled that in terms of legislation. And last question, I think no one can answer this question, because during the pandemic, local contact and any disease prevention-related inequality. But, government have spent a lot of money to stimulate the economy, causing inflation, and the money goes into the property market, causing structural barriers among countries and enhancing inequalities from country to country. This is not my area of expertise, so I don't understand this question fully. Between cities and between cities of different countries, what about the inequalities? What kind of approach can we have? And I think anybody who wants to tackle this question can tackle it. And now back to the order of presentation. And please answer these questions.
부탁드립니다, 브루노 선생님.
Dr. Bruno, would you like to start?
Yeah, thank you so much. So many interesting observations and additional information and thoughts. We are really stretching the discussion from the virtual issues, big data, artificial intelligence, to real life, the real economy, our real experience with data and prosperity. I focus on the very first question, if you allow me so, and that is because it's my key message: governance. It is so crucial. I would like to convey the message to the audience that probably last year we had the first instance in the world where a national government collapsed because of an algorithm. And that was in the Netherlands. And the background of that, and it connects to this initial discussion about inequality and tax data, etc. The Netherlands, somewhere in 2010, 2011, created a law allowing the tax department, the national tax department, to basically screen the income data of the population and to find those who were cheating, underreporting income, and were cheating on receiving poverty benefits. And so there was a big data application. 2010, 2011, perhaps not yet very sophisticated, but by now, 2020, 2021, countries like European ones or Seoul or Japan could do that in a very sophisticated way. The problem was the law said that data were so good and so credible and so objective that there was no need for a complaint procedure. And so households which were accused of over-receiving government grants had no way to legally go to the government or to the courts to say that the data were wrong. And for years and years and years, most in the bureaucracy knew the data were wrong. The algorithm was wrong. And the tax department even got 30 million additional euros to create better data, and they were still wrong. The problem here was, and smart technology specialist observed, that one, there was a belief that there was no issue of governance, that it was only an issue of data. It was an issue of governance, of just use of data. Secondly, the Netherlands has still no minister or state secretary for data, while in other countries these positions are being created. Thirdly, he said, look at where the innovation is happening. It's happening in cities. And that is because big data and cities, as I explained, the two are part of the same ecosystem. It's agglomeration. And so cities like Amsterdam, Barcelona, Helsinki have policies in place in which every algorithm used by the local authority must be public, must be open for scrutiny. Of course, data are not all public. Some data have privacy limits, but the algorithms must be public. It must be possible to scrutinize whether the calculations made by government bureaus to make decisions are valid or invalid, or are erring in one direction or another direction. And of course, in addition, every procedure of the government should not be built on the fallacy that data are always correct and algorithms are correct, and you cannot go to court or you cannot file a complaint. So the Netherlands was the first government that collapsed because of an algorithm. This is my message. And this colleague, smart city specialist, say, look to Helsinki, look to Amsterdam, look to Barcelona, which have policies in place to publish that. And that's why my appeal is for Asia-Pacific cities. It's 12:05 to start joining these global coalitions on digital rights for cities. I'm actually perplexed that not a single Asian city is a member of these global coalitions that stand up for digital rights for citizens, for transparency in the using of algorithms, that translate into policy the use of public data, that makes clear guidelines on how the private sector can or cannot be part of algorithm management and big data for public policy decisions. Not a single Asia-Pacific city is part of these global coalitions, but all the major cities of Europe, North America and Latin America, and even of the Middle East are joining. I think that is because Asia's cities are too much beholden to the fact that data are correct and algorithms are correct, that the specialists is correct, and there is no space for governance. So this is my message. I conclude with a message. Sometimes it's very simple. Finland has a national jealousy day. The 1st of November is the National Jealousy Day of Finland. What is it about? On the 1st of November, Finland publishes all personal income statements of all its citizens. So income statements, because we started to talk about inequality and tax and cheating, and are the poor people cheating, or are the rich people cheating, are the shopkeepers cheating, or are the Uber drivers cheating? No, make it simple. Everything is public. And that is the National Jealousy Day, because of course everybody wants to know on the 1st of November what my neighbor earned and what the richest fellow in Finland earned. Now, this is the start of an approach to data, to information, that in order to work as a society, whether it's a city or a country with data, there must be fundamental public properties to it. And that is governance. If there are public properties to it, it's also very clearly defined what are the private and the privacy issues and the rights to privacy in that. The decisions where that distinction is between what is public and what is private, and how the government can work in a public way with public data or with privacy protected data, needs all to be defined. So my message is really to this audience: please talk to your colleagues in city governments, including in Korea. Join these coalitions like the Coalitions for Cities and Digital Rights, because they are initiating major innovations in digital governance for the future of our life in cities. And as I explained, in the case of the Netherlands, these are national governments which will have to learn from cities how to do it, because that was the message. We shall not have more national governments collapsing because of faulty algorithms and false belief in the power of data without public scrutiny. Thank you.
Thank you very much. That is very astonishing, amazing, awakening. So we are going to continue to think about these issues along with the Seoul Metropolitan Government, and I think the people from Seoul Metropolitan Government must have heard you. And then we will remember to deliver and share your strong and appealing message with the people of Seoul Metropolitan Government. Dr. Kim, in my presentation, Well, I've mentioned that, I'm a social policy researcher, and in Big Data Forum, I don't know whether I'm supposed to be here, but we are planning to have a research on social capital. But we are not going to be developing a separate set of data, but welfare state data or Seoul survey or youth panel survey is something that we have been doing all along. And after COVID-19 outbreak, we have to define social capital and also social relations. After the outbreak, the young people we are also doing some research into one-person households and how the social relations has changed after the outbreak for young people and one-person households. And we are designing the questionnaires and surveys. I think that's all I can answer for now. And Dr. HaeKyung, you haven't received questions, but you can also participate as a discussant. You can make comments about other people's presentations if you want. I think she has been caught off guard. She wasn't expecting this. Among the discussants who are here, if you want one more chance to speak, we'll give you the chance first before we ask Dr. Park again. Dr. Hong, yes. You have received some questions. Yes, please answer the question, Professor Hong. I think Professor No Seung-chul asked me a question. Stable group. Compared to the mobility before COVID-19, the mobility data stayed more or less the same. I think it's a geographical skill difference because in Korea, because of COVID-19, we didn't necessarily move into different neighborhoods or different houses. But in the case of the United States, especially wealthy people, when their family had second house outside the city, many of them moved out of the cities, meaning that stable neighborhoods were people who could not afford to move out of the city and who had to continue to go to work and who had to continue to work for livelihoods. So they suffered more than other neighborhoods. In terms of policies, the New York City continued to receive the feedback and complaints from the citizens. And based on citizens' feedback, if there is any particular region that has received more complaints, then the government put more police force into that region to keep social distancing. And stable regions were especially prone to high risk of infection. And they have opened a lot of pop-up clinics to have the specific targeted policies.
그러니까 저희들 꽤 오래.
Well, we've been discussing for some time. Do you feel tired or bored? I hope you're not. We are supposed to wrap up at 3 p.m. Korean time, so let's wrap up. Professor Kang, would you like to make a short comment? Yes, Dr. Hong just mentioned this, but let me just share with you a detailed message. In case of New York, if you look at New York data, they have mobility index or exposure date and etc. And if you look at your daily life, if you don't move around, if you don't go outside, you look at the exposure rate decreases, or on the contrary, you might not move around at all. You just stay at home, or you just go outside and you never come back. Do you know that Airbnb, they suffer from deficit, but because of the COVID-19, they are enjoying a tremendous profit surplus. Do you know why? Because people go to a certain place, stay there a month or 2 months using Airbnb. This is unexpected result or phenomena. So activity, something that dropped, suddenly we need to understand the implication of that. Probably we can interpret it in terms of the inequality, why such thing happens. Activity, when we look at it, sometimes the residential activity increases, but if you look at the absolute number, it actually decreased. Comparatively speaking, it increased, but most of the time it dropped. What does it really mean? You need to understand. And of course, all of you are researchers, so unless you carry out an in-depth studies, probably we might end up making a wrong decision. So there could be some pitfalls. So I just want to emphasize that. And in the same context, the extreme heat or inequality, all of this, we need to think about the narratives. What kind of consequences will we suffer from? We need to understand that. So the first stage is opening the data, and secondly, Dr. Bruno talked about very important thing. Through this process, in Korea, the central government said that, okay, we will analyze and we'll give you the result, just follow that. That was the attitude, but we shouldn't stop there. We need to make extra efforts. We need to think about what should we do using this data. We need to make open this data so that each individual need to develop him or herself. And instead of the top giving answer and then give order, we need to change the system so that everyone can read it transparently and then make a decision. That's all.
어려운 말씀.
Yeah, that is a very challenging thing. Dr. Park, I was caught off guard, flustered greatly, but I'll try to pull myself together again. Since we are here for Big Data Forum, we've talked about data in depth, but I want to talk about something else. Compared to 10 years ago, we have more than enough data right now. We are flooded with data. You know, the most important thing now is the perspective of the researcher and the government's interest. What is the government interested in? So as for the existing data, I think we can look at a lot of new things, discover a lot of different things. And I talked about heat wave and inequality. I wasn't aware of this issue before. So if we believe there is inequality and begin to see the data from that perspective, I discovered many new facts, meaning that social priorities, highly important social issues must receive proper attention, and then that will guide us about how we can look at the data. Thank you very much. We've had a very long discussion, and I'm not an experienced moderator, and we have been jumping all over the topics and to the audience. I'm not sure whether you were able to follow us all along. But as a moderator, I really had a good time. Dr. Bruno Dercon started this session. And then from various perspectives, we've talked about inequality in our society. Inequality was kind of the keyword for our session. And we've talked about various research that are being carried out. And Dr. Bruno Dercon's keywords were all resonated across all presentations. And We can also learn a lot of things from the data, but we created big data, and COVID-19 has had impact on inequality level, and our response probably is the consequence or the result of inequality. So that has widened our perspectives about how we should understand and approach inequality. And I found today's discussion highly insightful and helpful. And let us conclude this discussion. I would like to thank Dr. Dercon, Dr. Hong, Dr. Kim, Dr. Park, and discussants who have joined us online and offline. Thank you very much. Now, we would like to conclude the fifth session